Hi, I'm Jennifer Sosnowski. I'm a family practice physician here in Phoenix, and I have 2 children who are tongue-tied. This is Sean. He is my youngest. He's currently 5 months old, who has had 2 tongue-tie procedures from Dr. Agarwal. And I have a 2.5-year-old son, Kyle, who introduced me to tongue-tie. And as a family practice physician, we knew what it was, but never had diagnosed it in anybody in the past. But my 2.5-year-old, Kyle, had heart surgery at 2 weeks of age and had started with colic at 2 days of age. And we had assumed that the colic was due to heart problems, but he never stopped screaming. And by 5-6 weeks of age, 2 or 3 weeks after his heart surgery, when he was supposed to be otherwise fine, he still was having problems screaming and never seemed to be full. At which point we called a lactation consultant who came over 3 different times for about 3 hours each. And finally, after the 3rd time, with me still having problems breastfeeding, she told me the baby must be tongue-tied and we should call Dr. Agarwal. So Dr. Agarwal saw us, and my son did have tongue-tie, and we went ahead and did the tongue-tie procedure. Unfortunately, he was also on aspirin at the time for his heart, after his heart surgery, and he was Dr. Agarwal's one complication. Poor Dr. Agarwal got called in at 10 o'clock at night after he had had a screaming fit with his colic and burst open the line that they had cauterized underneath his tongue. And by the time we got to the office, it really wasn't bleeding much anymore, but was a little bit panic-stricken. Couple of panic-stricken parents when your kid starts spitting blood all over the place after the procedure. After the procedure, Kyle really he got a little bit better breastfeeding, but never really did fabulously, and we never really knew why. But one of the things I had noticed was that his upper lip always seemed to curl under when he was trying to breastfeed. So I managed to breastfeed for almost 6 months, and my goal was at least 3 months as a physician, knowing how important it was to breastfeed. I considered it a good deal, although I always had to supplement formula because he never seemed to get enough. With Sean, he was a little bit easier. He came out obviously tongue-tied, so initially he seemed to latch on very well and seemed to eat really well, and didn't seem to have a problem. And since he was gaining weight fine, the consensus was from everyone that he must be fine in spite of his tongue-tie. However, by the time he was about 8 weeks old, I was getting really frustrated, spending about an hour and a half at a time sitting on the couch feeding him, because my, at that time, 2-year-old would take full advantage of the situation. And I finally decided that an hour and a half for each feeding when you were doing it every 3 hours was a little too much. And so I finally asked a dentist friend of mine who said that the tongue-tie caused severe problems later in life in terms of dental complications, needing braces, as well as what Dr. Agarwal's video had shown with complications of TMJ and migraines and receding gums, all of which I have. So I suspect that I'm the one that's guilty of giving these guys tongue-tie. We got in to see Dr. Agarwal, and this little guy not only was tongue-tied, but also was lip-tied. So he had both a tongue-tie procedure and a lip-tie procedure about 3 weeks after that. And after the initial tongue-tie procedure, it was amazing. He went from taking an hour and a half to eat to taking 10 minutes. Which was life-changing in the household. So I was overjoyed. I still decided to do the lip tie procedure anyhow because of the complications that my dentist friend was telling me about in terms of needing braces for a split between the front teeth because of that. And he actually got much better after the second procedure as well. In retrospect, I went and talked to Dr. Agarwal. I said, if this guy has a lip tie, my older son really had a lip tie because he still had problems after you did the surgery for him the first time. And I said, were you doing lip ties back then? He said, nope, didn't know about them. And I said, well, how about you look at him? Let's consider doing it. And actually, he was he had just as bad a lip tie as Sean did, and so we actually got him in to do the procedure. It was completely painless. He had no problems afterwards, and he did the procedure without anything more than a local anesthetic, and my husband was the one that got to go in with him. I certainly didn't. That was too much for Mom. But even as a doctor, you don't do your own kids. But he tolerated it well and has had no problems whatsoever with it. And so I'm hopeful that we won't have to spend thousands of dollars on dental work later in life, and that hopefully that they will be spared the migraine headaches that I've suffered with for years. Yeah, as a physician, I think the one thing that I would say that, when you're a mother, you're breastfeeding, it's all different. We never got taught breastfeeding in school, really, and so every child is different, and you have no idea what's normal. They say that normal is anywhere from 20 minutes to an hour and a half to breastfeed. Well, if you're hitting an hour and a half, it's not normal. So even if they tell you your son or daughter is doing fine in spite of a tongue tie, or if it really does take that long, it's certainly worth getting in to get it evaluated to see if that's the case. And if as according to my dental friend, it truly does help prevent dental problems and a lot of medical problems later in life. As easy as the procedure is, I would suggest everybody get it.